Welcome back. The National Institute for Communicable Diseases says 6,375 new cases of COVID-19 have been reported in South Africa. Now, the positivity rate is just under 20%. Another 18 COVID-19 related deaths have been reported, with 6 occurring in the latest 24-hour cycle. The national death toll is 100,916. Active cases stand at 81,174. Let's take you to this now. The World Health Organization says about 80 cases of monkeypox have been confirmed in 11 countries, warning that more cases are likely to be reported. The organization says that another 50 suspected cases are being investigated without naming any countries. Earlier infections were confirmed in Italy, Sweden, Spain, Portugal, the US, Canada and the UK, where the first European case were reported. Now, let's discuss this. We're now joined via Zoom by Dr Jacqueline Weyer from the Center for Emerging Zoonotic and Parasitic Diseases at the National Institute for Communicable Diseases. Dr. Weyer, thank you so much for your time. Now, we know that the virus has been, as I've said, detected in 11 countries. Other countries, 50 suspected cases being investigated. Should South Africa be worried?
This is definitely an unusual event. Monkeypox is usually a very rare disease in the human population, and this is the first time that we're seeing a multinational outbreak of this extent. If we look at numbers in Spain, 30 cases confirmed, Portugal 23, and in the UK already 20 cases confirmed. So certainly something unusual. But we do believe that this is a single source introduction and that somehow these individuals are connected. Most of these cases are involving international travelers, so somewhere, and this is still under investigations, these individuals, their paths did cross. So there's not a concern currently in South Africa. We've got no suspected or confirmed cases in South Africa yet. And we are working with health authorities to raise awareness and vigilance so that if we do have any cases occurring in South Africa, that we can diagnose and deal with them swiftly.
Now, tell us a little bit more about this virus. How is it transmitted? And do we know how efficient monkeypox is at transmitting from person to person? I know that, it is a very rare disease.
Absolutely. So monkeypox is actually a disease, it's called a zoonotic disease. So it's actually a disease of animals that incidentally spills over to the human population. It's mostly reported from the Western and Central African region. It has been associated with an outbreak connected to exotic pet trade in the US in 2003. The disease is normally not readily transmissible from human to human. But it is transmissible at a low level. So this is through very direct contact, and it can be through the respiratory route given prolonged contact between individuals. There's also some talk currently of current cases involving sexual transmission. So we're keeping our eye on those reports for confirmation of that.
Now, I see you mention, a pet trade and those other industries. Who is likely to be at risk, for monkeypox?
Currently, it looks like this is, the indications are that this is associated with a single source introduction into the human population. Currently, we think it was in a traveler to Nigeria that we still need to understand the contact that that individual had within that context, and then through close human contact, a transmission between these individuals. So it's still early days of investigation, and we're waiting with bated breath to see how these cases link together. And of course, in the public health response to these confirmed cases, contact tracing is done. So any additional cases that may then occur will be followed up and isolated so that we can interrupt the transmission of this virus.
Now, we know that it's not a highly contagious, disease, as you've rightfully said, but what do the symptoms, portray? What are some of the diagnoses that you see in someone that has contracted this disease, and how dangerous is it for that individual?
Absolutely. So it's definitely not the most contagious disease that we've dealt with or deal with. It also has a low case fatality rate, about 1%. So most individuals have a self-limiting disease of about 2 to 3 weeks, which involves flu-like symptoms. So this is fatigue, fever, rash, or the rash is actually not flu-like. The rash is actually what makes it quite different. But fever, malaise, body aches, and then the rash that occurs 2 to 3 days after the onset of illness. The rash looks a lot like the rash that you would have with chicken pox. So it's a blister-like rash. And this resolves over the course of 2 to 3 weeks, after which, in most cases, individuals recover fully without any side effects.
Now, is it one of those conditions where the older you are, when you contract it, the worse the illness is, like we've seen, with, the urgency of having people that are older to vaccinate against, for instance, COVID-19?
It's difficult to say. There's been so few human cases over the years that it's difficult to make those conclusions with a lot of with a lot of faith. But what we can say is that most individuals do well. I think vulnerable individuals, those that are immunocompromised for whatever reason, might be at greater risk. And then another issue that comes to play here is that the smallpox vaccine, which was administered population-wide up until about 1980 in most countries, actually partially up to 85% protection for monkeypox. So we actually expect residual immunity in individuals at the age of 40 and above in South Africa, because we stopped smallpox vaccination around 1980. So it would be there should be some level of immunity in 40-plus population.
Now, we know that Sweden plans to classify, smallpox as a generally, dangerous disease, but from what I'm getting from you, it's not that, to be concerned about. But the problem probably also comes, in terms of COVID-19 pandemic, especially here in South Africa, having drained so many resources for other diseases. Are there enough vaccines, for instance, for this particular disease?
So for monkeypox, generally, as I've mentioned, it's not a serious human disease, but of course you don't want it to spread unabated. One wants to interrupt the chain of transmission as quickly as possible and remove circulation from the human population. So smallpox is an entirely different disease. This was also, monkeypox is actually often referred to as a smallpox-like disease, but smallpox is actually a human infection, which is very common, which was eradicated by vaccination by 1980. So it's in our population that was vaccinated for smallpox that there might still be some level of protection against monkeypox. These are closely related viruses. So smallpox doesn't occur naturally anymore. It has been eradicated. Monkeypox is rare. Usually not of great concern, but we do take the matter seriously, want to remove circulation of the virus in the human population as soon as possible.
Now, Doc, as we wrap up the interview, in my introduction, we did say that the WHO has, of course, confirmed these 11 countries, but warning about 50 others and not naming any of them. Do you, at this moment, have close, communication with the WHO? Are you communicating with them in terms of, what risks you ought to look out for?
Absolutely. We are in conversation with the WHO, but many other international stakeholders as well, making sure that we follow similar approaches and also that we keep up to date in terms of what's happening internationally and how that relates to a risk for South Africa. So that's a continuous conversation that we do have with these stakeholders. So within South Africa, we are currently working to, as I've mentioned, raise vigilance and awareness in our healthcare workers. And we are ready to test at the NICD if there would be any suspected cases. So we would be able to confirm such cases quickly and then institute the public health responses to limit any further spread.
Dr. Jacqueline Weyer, thank you so much for your time this afternoon.
Thank you, Nati.
All right, let's continue here now. The Department of International Relations and Cooperation says it has in recent days noted false and irresponsible newspaper reports indicating that hundreds of former ISIS fighters have been repatriated to South Africa through a secret operation carried out since 2019. The department says the reports have no factual basis.
The Department of International Relations and Cooperation has in recent days noted false and irresponsible newspaper reports indicating that hundreds of former ISIS fighters have been repatriated to South Africa through a secret operation carried out since 2019. The reports have no factual basis whatsoever. The South African Embassy in Syria is monitoring the situation of 16 women and children who are in Syria to confirm their South African citizenship and then provide assistance. Consultations with Syrian authorities are ongoing in this regard. It is important to know that DERCO is entrusted with the responsibility of providing consular services to any South African in distress abroad in a transparent manner and within the framework of the South African and international law. The newspaper reports alleging that DERCO has facilitated the repatriation of hundreds of ISIS fighters are devoid of any truth and violate the press code.
Minister of International Relations and Cooperation, Dr. Naledi Pandor, engaged in the virtual edition of the 5th standalone BRICS Ministers of Foreign Affairs and International Relations meeting. The event was hosted by China in its capacity as the incumbent BRICS chair. The theme was Strengthen BRICS Solidarity and Cooperation, respond to new features and challenges in international situations. The BRICS Plus foreign ministers invited to the dialogue were from 9 countries, including Nigeria, Egypt and Senegal. A BRICS Plus outreach has been taken on the sidelines of the summit before, but this was the first time that foreign ministers from non-BRICS countries were invited to attend a meeting of the BRICS foreign ministers. South Africa initiated the outreach program during its first chairmanship of BRICS in 2013. South Africa, as the incoming BRICS chair for 2023, will host the BRICS Ministers of Foreign Affairs and International Relations meeting in September this year in New York.